Good day everyone! Today we will talk about ecbolic drugs. So ecbolic are also called myometrial stimulants. These are agents that bring about increase in uterine contractions. So here are the list for the clinical uses of oxytocin. First is for expulsion of retained placenta. Second is for labor induction given by slow IV in dextrose solution. The third one is for milk letdown but only in agalactic animals. For treatment of uterine inertia and for rapid involution of uterus is the fourth one. And lastly, to arrest postparturient hemorrhage. For the dose of oxytocin, we have 5 to 25 units in female dogs, 75 to 100 units in cows and mare, and 30 to 50 units in sow and ewe. These are the three examples of ecbolic agents and drugs. First is the oxytocin medication, which stimulates uterine activity and are used to induce labor, increase contraction, reduce the risk of postpartum hemorrhage immediately after birth, and expel fetal contents in incomplete abortion. The second is the ergot alkaloids, which are from the fungus Clivoveps purpurea. Ergometrin and ergonovin have prominent effect on the uterus, not preferred for induction of labor, generally indicated for postparturient hemorrhage, rapid involution of uterus, and retained placenta. And the last one is the PGF2 alpha or the prostaglandin F2 alpha exerts potent stimulant action on myometrium. It is also popularly used for its urolytic effect.